Last year, we talked about various disease stages of prostate cancer and how we treat it. And this year, we're going to talk about how do you make the diagnosis and what does that lead to if you have the diagnosis of prostate cancer. Let's start with the diagnosis itself. Prostate cancer is a curious disease that actually does not necessarily manifest itself with any symptoms unless it's presented late. If someone presented with metastatic stage 4 prostate cancer, they might experience bone pain, difficulty in passing urine, blood in the urine, and even problems with anemia. However, when men have early stage of prostate cancer, the one thing that we want you to do is do a medical checkup and do a cancer marker. The cancer marker is called PSA. It's actually a prostate-specific antigen. That itself just tells you something is wrong with the prostate, but not necessarily cancer. So don't worry if your PSA goes up. So PSA going up, it just increases your risk of making the diagnosis of cancer. So in order to do that, we have various forms to delineate or to determine whether you've got cancer. In the modern technology and also modern medicine, there are effectively two ways to do that. One is to do a biopsy. A biopsy of prostate entails a needle going into the transrectal ultrasound probe and extract some samples. The biopsy itself may be a bit risky because biopsy can cause bleeding and can cause sepsis or difficulty in passing urine. So other form of detection of potential prostate cancer is an MRI scan. The MRI scan will show the configuration of prostate to see whether there's any risk of cancer. So we label it as 1 and 2 being low risk of cancer, 3 intermediate risk of cancer, or 4 and 5 having high risk of cancer. If 4 and 5 appears on your prostatic MRI scan, then we will do a targeted biopsy in order to enhance the yield and also reduce the complications. So for men who don't have symptoms and subsequently had a blood test that is abnormal, then MRI or a direct biopsy will determine it. So for following week, we want to determine if you unfortunately have the diagnosis of prostate cancer, what are the ways to stage and grade the cancer. If you're interested, stay tuned for next week's Putting Dr. G on the Spot.